Hi, my name is Jillian Geiger, and today I'm going to be administering a cleansing enema. I have already introduced myself. I have verified my patient's name and date of birth. I have checked her creatinine, BUN, and electrolyte levels. I've assessed her intracranial pressure. I have asked her about her last bowel movement, when it was, the color, consistency, amount, anything abnormal about it, and I have assessed her sphincter tone and her ability to retain things. So now we're going to go ahead and get started. I have already explained to her the purpose of the procedure, like what to expect, the kind of feelings and things like that. So typically I would have my supplies right here. I would not turn my back to my patient or to my supplies, but for the purposes of this demonstration, the table is over here, so I am going to have to step right here to grab the supplies. So I am going to start by, and I do only have 2 pairs of gloves, so I would just notify when I would, or I would just verbalize when I would change my gloves. So I'm going to step off to the side, grab my gloves, and they are clean. This is not a sterile procedure, so all my supplies are clean and not sterile. But I'm going to turn my patient, and I do have all my supplies off to the side. I do not need assistance to turn my patient. She is able to help me, so that is why it is just me. I'm going to put her on her right side with her right knee bent and her left leg straight. Okay, just like that. Alright. She's moving on me a little bit. Okay, and then I'm going to grab my pad, put this underneath the patient, so that way if anything leaks out or anything like that, obviously it's not going to be all over her bed. I'm now going to grab the bath towel to drape her. To allow for some privacy. And I do already have my enema solution. It was warm, not in the microwave, and it is between 105 to 110 degrees. It is 500 to 1,000 milliliters, and I do have that. So now I'm going to get the enema supplies, and I'm also going to have the bedpan ready right here. Obviously with a bedpan like this, the big side would go towards the back. So that is ready, and I'm going to open up. I would change my gloves now and perform hand hygiene, and I did perform hand hygiene before I started or put on my gloves. So, going to get my enema supplies out, basically. And then if I did have my solution on hand, I would administer that and administer the soap suds into this, and it is a Castile soap concentrate. I would mix those, and then what I would do, and I have made sure that the line is clamped before beginning that, and then I would hold the end of the tubing. Can you tell? I would hold the end of the tubing over the trash can and unclamp to let it to prime, and once it's got to the end, I'm going to reclamp it and put it on the IV pole. And now I'm going to, if this enema was not pre-lubricated, then I would lubricate the end of it, but it is pre-lubricated. So now I'm going to get ready and insert it 7 to 10 centimeters. And if I felt any resistance or anything like that, I would stop. Or if my patient was in pain, Also, as I'm inserting it, I'm going to instruct her to take slow, deep breaths. And if there's any excruciating pain or anything, to notify me. Now I'm gonna bring it down to the level of her hips and unclamp it, slowly raising it. And then I'm going to hang it back on the IV pole, and I'm going to leave it until the solution is completely administered. And then after it's completely administered, I'm going to remove the tubing and take this down. If there was fecal matter or anything like that on the end of the tubing, I would have toilet wipes or something like that around it, and I would wrap it up. There is no fecal matter, and I do not have those supplies with me for the purposes of this procedure. So I'm just going to discard this off to the side. And then if she was incontinent, then I would leave her on the bedpan, but she is not. So I'm going to sit her back down on the pad just in case anything leaks out. And then I have also checked her sphincter tone again to make sure that she is able to retain this enema. Typically that would not happen. I would have it off to the side. That would never happen in a patient's room. And then I would leave her with the call light for 5 to 15 minutes. And if she needs me, if she's in any pain, she can call me. And as soon as she feels like she is ready to have a bowel movement, she can call and let me know, and then I will assess the bowel movement and all those things. And I would obviously assist her to the bedside commode or to the toilet if that is what she wanted. Then I'm going to take my gloves off and perform hand hygiene. If she had any complications, obviously I am available. She can call me on the call light and I will come and check. But if there was any issues, any difficulty putting the enema in or anything like that, I would obviously contact the doctor, and I would document the bowel movement on the graphic sheet with amount if it was measured and things like that.
Thank you.